Well, good morning, everyone. I have to thank the Professor Thelma for this invitation. It's really a pleasure to be here, really an honor to be able to deliver this talk to you. Well, my talk today is on the use of ionizing radiation for the synthesis of nanoparticles and the advanced wound dressings. It's a quite different subject from what you have seen here in this meeting. But anyway, I hope this can be a contribution for you guys. My name is Ademar Lugao. Something wrong. I come from the Instituto de Pesquisas Energéticas e Nucleares. The outline of my talk, well, the problem, what you see as a problem, the continuous increase in the cost of medical services and goods, and our underfunded universal health system, the famous SUS. Well, how radiation processing, how nuclear techniques can contribute actually. So we are going to talk about radiation processing characteristics and about one-pot technology, because radiation processing allows one-pot technology very easily. And some one-pot technology developed at IPEN. Gold 198, albumin and papain nanoparticles. I will focus on the albumin nanoparticles, and the wound dressing with silver and gold nanoparticles, with silver, mostly with silver nanoparticles. Well, the motivation is very clear. Fortunately, we are living very long. Thelma very kindly said that I have 30 years of experience. No, I have 50 years of experience, actually. So I just leave in my resume 30 years, because 50 years is too much. So, we're living very long. And the burden of the universal health system is less and less people is able to cope with this burden, the cost, and so on. And fortunately, we are living very long, but I don't know if that's a really good thing. The people is having fewer and fewer babies, so the population, the increase of population, the rate of increase of population actually is decreasing constantly, mostly in developed country, and now in developing country also, in Brazil also. The population is going to be stable very soon. So this is a huge problem for these characteristics. Well, and the old people, you know, old people get mobility problems. This is just one of the problems of old people. So you got a lot of pressure wounds for old people, a lot of pressure, but diabetes and a lot of other health issues. And so this is really necessary to do something to decrease this cost of treatment of these people. Well, this is some interesting data, just to, let's say, to discuss a little more about this problem. You can see the increase. This is from 2018 to 2022. See how in this just 4 years, how the cost of healthcare spending per head is increasing in the United States, even in Western Europe, and in the other regions of the world. It's not increasing too much because we don't have money to spend. So, but the trend is very clear with the increasing costs. So this is our ordering data from our ordering data. You can see the increasing also in the spending in the Western Europe countries. Brazil, Argentina is here, and the life expectancy. And so Brazil is about 75 years, and Argentina a little more, and Chile, Colombia, Chile is a little higher even. But surprisingly, the United States by far spends much more than any other country, and the life expectancy is just about, is below 80 years, about 70, 80 years. So, and every country there are in every developing country there are a tendency of leveling off this kind of spending. Again, just for curiosity, some other comparison with Brazil, Argentina, Colombia, and Chile. So you can see that Chile has almost the same, is above 80 years old, their life expectancy. And the same culture, the same, but they have a much better service over there. But very curious, you can see from Korea, the Korea with very few spending, the same level of South American country, Korea had already a much higher life expectation, and this is very high expectation without too much spending. So spending too much, spending a lot of money is not really directly related to the, let's say, to the quality of the service that you have for medical care. You can see, but the United States is just terrible. So it's more than 10 times of other countries. Is very, very low. So as a conclusion, it's crystal clear that the cost of medical service are increasing in all over the countries, without clear benefits in life expectancy. Therefore, it's necessary to promote effective medical products and process at lower cost. So we have a world-class facility in São Paulo at IPEN. We have, let's say, about 40, this number is decreasing, every day is decreasing, 150 permanent staff, about 100 technicians under contract. We are part of São Paulo University for nuclear engineering studies. We have more than 4,000 students over the 35 years. We are level 6 from CAPES, the maximum level is 7. We have a second graduation program on the application of radiation health and many other characteristics. But we are in a very serious crisis because the people is getting very old and they are not getting replacement for these people. But still have a very interesting facility. We have one research reactor, about 4.5 megawatts or 5 megawatts that is used for material research, for radioisotope production, for many other things. For nanotechnology, a lot of nanotechnology is done over there nowadays. And nowadays they are developing, start again to produce radiopharmaceuticals. They had stopped, they are producing again radiopharmaceuticals. We have one critical reactor, only 100 watts, for studies on geometry of nuclear submarine reactors or compact reactors. We have a bunch of maybe 3 or 4 cobalt-60 cobalt-60 source, 1 multipurpose irradiators, some industrial irradiators, 2 electron beams accelerators, 2 industrial electron beam accelerators, 2 cyclotrons, 18 and 30 mega electron volts, laser 1 terawatt power, peak power, vivarium, and many other facilities. Those facilities are open facilities. We have here the people that is in charge of this facility. Dr. Carmen from the Center of Irradiation Technology is here. So, and our research reactor is also an open facility. You are welcome to visit and welcome to work over there. Those are the cyclotrons. We cannot produce for industry anymore the short life isotopes because the private companies are producing, so are not allowed to produce. But are doing research to develop new ones, new short life radioisotopes for PET. And you have a really dynamic radiopharmacy producing a lot of long life radioisotopes. And nowadays they are working with with, I think, terbium. There started to work with terbium, and also lutetium. Lutetium, because it's very famous, PMSA lutetium, is a billion-dollar product for prostate cancer therapy and so on. And you want to make something a little different, cheaper, more affordable for that. So this is the goal of IPEN, to make things more affordable, the medical treatment more affordable for everyone. So how radiation processing can contribute? Radiation processing characteristics, we are going to see a little bit of that, and the one-pot technology. Well, the previous speaker already told something about that, but I will repeat very briefly. So in the solid polymers, I'll start with, I'll start with free radicals in the main chain. But before the free radical, you have ionization, excitation, and so on. And after that, you have the combination reactions and so on. That finally you get the free radicals located in some part of the polymers. This can allow radiation cross-linking at the room temperature or even freezing. You can have a reaction at very low temperature, at freezing temperature. The system can be very pure. It does not need cross-linkers, sensitizer, and so on. It's a very pure system. This is important to remember. Reduction in material loss as cross-linking is separate from shaping, because you have a lot of industrial application of cross-linking, tires, for instance, packing, tubing, and so on. You don't realize that you have a lot of products among us that are cross-linked by radiation. And this, do the shaping separated from the cross-link is very important. The robustness of the process can allow precise control of the polymer modification, cross-linking or degradation or grafting. Much faster processing speed, there is no heat transfer problem. You have no problem with the heat. And the curing at low temperature and solvent-free curing. So this is very important for materials like this flooring and so on, furniture, printing, and many other processings. Well, but most of the time we are working in eco solutions. So the previous speaker already told about the hydrolysis of water. A lot of species are formed, but mostly we have the hydroxy radicals and aqueous electrons and protons. So we have a reduction, a high production of reducing species and a very high production of oxidative species. So this allows that the synthesis can occur at any liquid water temperature. The system is also very pure because we don't need to put reductive species or oxidative species. Effective radiation is multiplied by the creation of the radiolytic species. So I can work in much lower doses. In the case of nanoparticles, synthesis size can be easily controlled by dose rate. You can get that very easily. That is very perfect system for one-pot processing. We are going to see that very, very, very soon. So what is one-pot processing? Well, it's a multi-stage reaction without intermediate separation. So you can have everything in one pot, one chemical reactor, and you use the same chemical reactor. At once you have many reactions in the same reactor, or in the same reactor without purification, you have a sequence of reactors. So you have reduced waste and cost by eliminating the need for intermediate purification and isolation. One-pot synthesis minimizes waste generation and associated costs. You have a simplified operation. The entire reaction sequence occurs in a single vessel, simplifying the experimental process and reducing the need for multiple transfer and manipulations. If Of course, if I have a single vessel, I don't need to do transfer and so on. You have safety. You have a high safety. It's safe. You have efficient and safety. Versatile, of course. Time savings, of course. And finally, pot economy. So this is the sustainable chemistry. You can do the sustainable chemistry by try to do one pot processing as much as possible. So I'm going to show you some one-pot technology developed at IPEN. So I start probably with wood dressing with silver, albumin nanoparticle, papain I will not show, but very similar to albumin, and the gold nanoparticles. Very interesting, gold nanoparticles. Gold 198. Because gold 197, of course, is the normal gold. This is one of isotopes of gold. I don't need to tell you that. Well, so why one-pot technology for, let's say, wound dressings? We know that sterilization is mandatory for medical products in contact with blood or body fluids. Sterilization is mandatory. So if sterilization is mandatory, and sterilization is achieved with doses over 10 kilograms, usually 25 kilograms. But the minimal dose usually has to be 10 kilograms if the product is already almost sterile. So you can work with 10 kilograms. But usually you have to go to 25 kilograms of minimal dose. Cross-linking of a variety of hydrogels can be done at this range of dose. This is not a problem. Reduction of metal ions and stabilization can be done at this range of dose also. So synthesis of hydrogels and nanoparticles can be done simultaneously with sterilization. So with sterilization, that all the medical products have to go, you can do everything. Because all the medical products that are going in contact with blood and the body fluids has to be sterile. So in the same operation, you can do a lot of chemistry on that. This basic method was developed by Professor Jan Zojak. He was the inventor of this patent, and he was very kind of transferred this technology for us at IPEN. But after that, we developed further other patents also. So this is the hydrogel that we developed at IPEN, and we transferred for the company some years ago, but the company, unfortunately, they stopped the production of that. This is the main characteristic of these hydrogels. You can see that it's completely transparent. You can see that it's soft, flexible, mechanically strong to allow easy manipulation, has moderate absorption of exudation. This may be a problem. It's a bacteria, very good bacteria barrier. It has oxygen permeability. It's water. It's 90% of water, so oxygen is not a problem. And for me, the most important, one of the most important characteristics is pain control, because it simulates like the skin. The pain of the wound comes from you lose the skin, you lose the epidermis, so you have a tremendous feeling of pain. So this can, let's say, can be considered artificial skin that will control the pain very effectively. And very low production cost, because you have sterilization and cross-linking of all the gel at the same time. So after that, we increase also the simultaneous production of silver nanoparticle in this kind of hydrogel. You could got simultaneously the characteristics of anti-inflammatory from silver, microbiocidal characteristics of silver nanoparticles in that in just the same step, everything in one pot simultaneously. Unfortunately, I didn't came with the photo of our hydrogels. I forgot that. Sorry. So just to repeat again, Sterilization is usually mandatory for biomaterials, achieved usually with 25 kilograms of minimum dose. Polymer modification, mainly hydrogels, can be achieved in the same range. Therefore, it's possible to cross-link and sterilize the hydrogel in simultaneous. Cross-link and sterilize the hydrogel, but it's possible to do reduction of nanoparticles, stabilization of nanoparticles, and even charging of nanoparticle if it have some peptides or polyphenols in the same step. It's an excellent route to develop low-cost advanced hydrogels for wound dressings. So these are our pilot production at SCAN. This is Professor Jan Rojak. He passed away last year. He was with IEA. He helped us with the transference of this technology. This hydrogel is sold in Poland, in Russia, in Kazakhstan, and some other countries of the world with the basic technology from without silver, because silver is our technology. This is the layout of the system that we developed at IPEN, this automatic system. Now this machine, the system is broken, but I got some money to do again. Let's see if I can do again. And see, this is some data, some comparison of how hydrogels with commercial products, they alginate with silver nanoparticles, foam with silver nanoparticles. Foam is a very good product because infected wounds usually have a lot of exudation. So foam is very good to absorb exudation. This is our hydrogel with silver nanoparticles. So the hydrogel is a lot of water, 90% of water. So the absorption of body fluids is maybe it's not that good. Of course, not that good. So, but this was a study with the chronic wounds. So in the first week, you could see that alginate had almost no reduction. The foam had a much better reduction, but the hydrogel with silver nanoparticle has a tremendous, wonderful results. So at least for that chronic wounds that was done in Uberlândia from the reference center on Hanseníasis. Hanseníasis is still, leprosy is still a big problem in Brazil. Only India, I think, has this problem more intense than Brazil. It's just unbelievable that you have a big problem with leprosy in Brazil. So this was a lot of wounds from leprosy and a lot of wounds of other chronic diseases. It was tested. So this was a proof that hydrogel works very effectively, and those wounds, they need humid environment. Hydrogel is a dressing that allows the humid environment, and the majority of the wounds, they benefit a lot from this kind of environment. And the second week, the difference was not so big, but in the following week, it's level off. Of course, the wounds are very multiple, and you are not going to keep the same dressing for all the phases of the healing. So in one phase, maybe one dressing is the best, in another phase, another dressing is the best. You have to see that. But you have a comparison with the cost of those dressings. So the cost of our dressing is less than $1 real, so $0.2 US per 100 square centimeters. And comparing with the other dressings in the market, you can see the difference in cost is just order of, it's just unbelievable. It could be unbelievable cheaper. Well, to be fair, this was the cost of production of the gel. This is the price market. So maybe I have to put 5 or 10 times here. So the difference will not be that large. So this is another problem that we developed during the COVID with silver nanoparticle developed in our laboratories. This filter on the ventilators, the machine, the ventilators for artificial respiration, they accumulate a lot of liquid inside, and you have to change this filter at least every day. And you have to change very fast because the patient is the ventilator. If you do not change very fast, the ventilator will not work, eventually the guy will die. So this has to be very fast inside the ICU. So a lot of liquid is that. So you have a liquid with contaminated bacteria, fungus, virus, and so on. So you have this, the spread of this contamination over the ICU. And most of the people that died during the COVID crisis died from infection from fungus and bacteria, not from the virus itself. So this was done. This was transferred for this company. This was my postdoc, Jorge Gabriel dos Santos. This was transferred for this company. They are producing that, and they try to put in the international market. They have a patent, application patent all over the world. Not all over the world, but most countries. So now I'm going to change the subject, gold 198 nanoparticles. So let's see, what is gold 198 nanoparticles? It has a half-life, and also 199. It's very similar. Half-life of 2.5 days, beta max of about 1 mega electron volts, gamma maximum about 0.4 million electron volts. So it's quite intense radiation. So the beta can use for treatment, and the gamma can be used for diagnostic. This is very theranostic nanoparticles. You can say theranostic nanoparticles. You are going to have the therapeutic payload from thousands of gold atoms. Not when you talk about usually radiopharmacy, I talk about a very few atoms. Now we have thousands, maybe millions of atoms doing therapeutic payload. So this was easily done by radiating gold 197 by neutron radiation. We are going to see how we do this as one-pot technology. But before that, we are going to show some work of a collaborator in Missouri University that developed this gold nanoparticle completely stabilized with polyphenols. This is polyphenols of mangiferin. Is a polyphenol from the skin of the mango fruit. It's very interesting because you can see here that they have a glycose molecule linked to the polyphenol part of that. So the cells, they love glycose. They need glycose. So, so this makes the endothelialization very, very effective. So again, the gold 198 is a lot of gold 197 mixed with gold 198. Because, of course, you do neutral radiation, but you have just a fraction, let's say 5% is 95% is radioactive, non-radioactive, and 5% is radioactive. So it's a mixture of both. Let's see this. I just told you about the endothelialization, the internalization of these nanoparticles. So here you have the PC3 cells, the prostate cancer cells, and just that. And here you have the cells with this kind of nanoparticle, with this phytochemical. You can see that the gold nanoparticle is fully inside the cells. Unfortunately, this is very clear. You cannot see in details. But this is the receptor. We block the receptors, the laminin receptors. We block the laminin receptors here. And you can see that the gold nanoparticles spread out. They don't internalize inside the cells. This shows how effective is this phytochemicals in this kind of procedure. So this is some very interesting results. You can see this is saline control. This is the mangiferin gold nanoparticle without radiation. This is a mangiferin 198. Mangiferin 198 in mice. We injecting prostate tumor in mice. It was injected in the interstitials of the tumor. So it was a direct injection, and we could prove by gamma camera, because this is with radiation, that the nanoparticles stay there. They don't fool around, they don't go around. They stay there in the tumor because of this, because they go inside, so they stay there. They don't leave the tumor. And this is interesting results after some days of measurement, the growth of the tumor, the saline. But you can see that with the gold 198, the completely control of the tumor. Professor Katesh, he told me that they did much more weeks, and still the control was achieved. But very interesting here, without radiation, you also got not that good, but also a relevant control of the tumor without radiation. So that shows that the gold 197 with the phytochemicals, as expected, has a kind of immunotherapeutic effect, actually. And that was proved by many other data from Katesh laboratories. Unfortunately, Thelma tried to invite him, but he could not come, so this is his work. I am collaborating with him only. So what, this is quite a new proposition. What his proposition was, this is a dual therapy. In theranostic, you have therapy plus diagnosis. Here you have a dual therapy. You have irradiation plus immunotherapy. So this was really very interesting. But he went further. So with this approach, with gold 198, you can have the irradiation of the tumor. You can have the imaging of that. You can have the immunotherapy together with that. Some of those materials now, without radiation, were getting and delivering to INCA, National Institute of Cancer, at Rio de Janeiro for final preclinical studies and clinical studies at INCA, because we have a lot of cases around, but quite like pilot cases that they work very well. Most of the cases in the United States and India. And now we are going to start in Brazil also this kind of clinical approach. Well, this is our nuclear reactor at IPEN, the 5 megawatt nuclear reactor. This was our one pot. We're going to see a little different from a little change from Katesh work here, because we decided to do a layer of albumin in this gold nanoparticle. Why albumin? Because albumin is also a molecule that is very, very important. The cells also love not only glycogen but albumin. They have a lot of mechanism to internalization of albumin. So, and you know, all the nanoparticles, they stop in the liver. So there is a problem with these therapeutical nanoparticles. They stop in the liver. So our idea is covering with albumin. Eventually, we could not only control the, let's say, the time of circulation, the circulation time, but also maybe allow maybe some kind of trade with the liver. The liver can allow some particles to continue, to follow the circulation on the body. So, we are working with the biology of the tumor against itself with albumin nanoparticle. We have the newly formed dense and liquid microvasculature. So that is use of nanoparticle for cancer treatment, the EPR effect. You have a compromised lymphatic drainage, so the nanoparticle can be there a longer time. You have a very hyperactive caveolar transport, so the penetration of the nanoparticle in the intertissue is very, very effective. And they have the utilization of GP60 albumin activated pathway. So at least, let's say, the prospect was is very positive, or is very positive for the albumin nanoparticle. By the way, albumin nanoparticle is used in many products for lymph node sentinella detection of sentinel lymph node, and is used for Abraxane products that is a $1 billion drug, because albumin is all the life beings, all plants, animals, so on. Albumin is in charge of transporting the chemicals, transport the drugs, and everything. So the nature did this nanoparticle, this protein as a nanoparticle to transport things for us. So this is the reason to use albumin. We did this is a kind of one-pot technology. Just have a globular protein in some defined conditions without oxygen, and sometimes with some ethanol, only ethanol to facilitate the agglomeration, and radiation, only that. And you got a structural arrangement. You can control size, distribution of size, and so on. No use of monomers, and you could retain the bioactivity. The bioactivity retained very well. We believe that is better retained than compared with other technologies. So we have patents, two or three patents on this technology. What else? Okay. So recently we did a study with melatonin that was awarded with CNEN of better dissertation, of master's dissertation last year. Are going to receive the prize next month. With melatonin has some effect. It's a hormone that you know linked with sleeping disorders, and but it also has an effect on breast tumors. So we did that, and by just one in the same one-pot technology, we could get nanoparticle with melatonin, and the results. Preliminary results, in vitro results, were quite good. Well, so again, with the gold nanoparticles and so on, we cover with albumin the particles in water solution during. So we are expecting that we could get a very good cross-linking, intramolecular cross-linking of the albumin. We could get a very, let's say, a layer of albumin covering these nanoparticles, and this would be, let's say, a kind of shielding for nanoparticles to avoid the liver effect and so on. So this was done with Mariano Grazelli from Argentina, that I'm very thankful to Mariano Grazelli. So this was the one-pot technology used for this production of data in our reactor. So in the same pot, we have we do the radiation. First, this 198 foil is put here with aqua regia and some sodium dioxide, and after that we could do citrate or some other stabilizer if you want. It's not necessary. No, this is the gold salt, but don't you? This is transformed gold salt after the aqua regia. This became gold salt, and with citrate, with the reduction, we got the gold nanoparticle pellets. And you can add albumin on that, and you will get the nanoparticle. So everything in the same pot, in the same place of the laboratory, of course, with the radiation protection and so on. You could do everything in the same pot. That was very interesting. So about 30 hours of radiation because the flux is not that high. So you could get maybe 10 to 14, but not more than that. So it takes time. But with a more powerful reactor that we are going to have, this can be much shorter. Well, this is just, this is interesting for you guys that work with dosimetry. So we did some studies on Raman of the surface of the nanoparticle. We have albumin. So we have albumin, and this is out irradiation, this is out irradiation. So you have a lot of signals of the groups of the phenolic groups of albumin. And after, so this nanoparticle, this cold nanoparticle was put in a gamma chamber with only 0.1 kilogray. We have a completely destruction of most of that. So with 1 kilogray, nothing. So that means that probably the gold nanoparticle is very, very oxidizing, very, very hot, because you have Auger electrode, you have a lot of other species that is destroying the albumin, actually. So, so this may be the reason that this do not work so well as we expect. So we are going to improve that. And finally, these are last attempt of collaboration in the kind of wound dressings, developing of products, ship products for serious diseases. So epidermolysis bullosa is a very hard disease known as butterfly skin, because these people usually has no cure so far. The skin is very fragile. You have a painful blistering after impact of abrasion, more usual than the skin. But all the epithelium can get that. If you have the internal epithelium of the body, you have a lot of internal epithelium, you are going to die very, 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 very fast, because you have death by infection, cancer, poor nutrition, and so on. Because, well, fortunately, it's a very hard disease. But because of that, there is no real good studies to cope with this disease. We have many types, and that's a problem, another problem. We have the simplex, the junctional, the dystrophic, and the kindler epidermolysis bullosa. I will not go in details of that. You have many related genes of that. Make it very complicated to make genetic approach to cure that one. But this epidermolysis bullosa dystrophic, you have just one gene related to collagen 7A1. Kindler also just one gene. So not to go with that. So you can see a photo where the epidermis is, let's say, there is no collagen linked, collagen 7A linking the epidermis with the dermis. So these are really very serious disease. Usually the kids that, as any kind of disease, you have from mild to very light, mild to very severe one. But in severe cases, those kids, they just die very soon. So there are a lot of medical approaches on that. Protein therapy, cellular therapy, symptomatic drugs, tumor-specific treatments. And basically, all are palliative treatments. But recently, it was developed a drug called Vivujec. It's a gel applied on the skin. And the gel has the gene, the collagen 7A gene. The carrier of the gene is the herpes virus, because you cannot put the gene over there without a carrier. The gene has to be protected. It has to be encapsulated with something. In this case, it was the herpes virus that is encapsulating the gene. So, it becomes very, very expensive. You know that because everybody took shots on the COVID crisis, and you get some from encapsulated virus that was Oxford and the Russian one, and so some vaccines was encapsulated virus, and some one was encapsulated with non-virus vectors. The Pfizer and Moderna was done with that. So we have to protect very well the gene in order to allow the internalization, to allow the gene, the integrity of the gene, to allow this capsule has to allow the endothelialization, the internalization of the cells, and it has to allow the release of the gene inside the nucleus of the cells. So it's a very complicated capsules, very complicated nanoparticles. And this, because of that, you have to work with, sometimes you have to work with the virus. One patient can cost 15 to 20 million US dollars a treatment for one person that will live a very few years. So it's always very expensive to treat these people. Oh, but in this case, with the genetic therapy, is very, very expensive. So our aim with the ionizing radiation here is reduce the cost of therapy through the development of non-viral alternative for the treatment of epidermolysis bullosa using gold nanoparticle, nanohydrogels is another technology, and nanoalbumin that we're focused now on nanoalbumin with the aim of reducing treatment costs. So this is how it was done with the virus. So you have the genetic material inside the virus goes inside the cells, the nucleus of the cells. It liberates the genetic materials, and it starts to produce the anchoring of collagen 7. This anchoring works with the integrin of the epidermis, and you can guarantee the connection of the cells, the dermis with the epidermis. This is the mechanism of action. So again, why albumin? Why you focus first on albumin? Because it's as I told you, biology against itself, newly formed dense and liquid microvasculature, compromised lymphatic drainage, and the caveolar transport mechanism that's very effective, and GPC6 albumin activated pathway. That was the, I hope that it would work very well. Hoping this will be very well. But, well, this was results from 1 month ago. So I was in a congress at Rio de Janeiro, and my student, Davi was working on that. He sent it on my email, on my WhatsApp. So worked. The greens are with get inside with the plasmidium with nanoparticles. So this was those are very preliminary results. And of course, this is still worked, but is not efficient so far. So we have to work to change that. But the protein does not work actually. We had to modify the protein. So this is the albumin nanoparticle. So no internalization at all. And this was the protein nanoparticle modified to make it more cationic. We had to make it much more cationic to allow this to have some results on that. But so we are very optimistic now about this nanoparticle. Well, as a general conclusion, one-pot processing, one-pot processing is not only sustainable, but a perfect match for radiation processing. Wound dressing with silver nanoparticle can reduce the cost of wound healing. Albumin nanoparticle cross-linked by radiation offer multiple opportunities to carry drugs and genetic materials to the cells. Nuclear techniques, in particular radiation processing, has a tremendous potential to be used in development of new low-cost medical products. I hope I was able to show you the potential of that at least. So I have to thank a lot of postdocs of my group, some students, some people from the clinical trial, funding from, we have in São Paulo, we are lucky to have FAPESP in São Paulo because it has working during many decades with very solid funding. It may be the best funding in Brazil, at least São Paulo can get from FAPESP, but also from CNPq, a kind of short one, but some help is always. And the National Commission always is helping us with the basic funding, salaries, and so on. And I have to thank a lot IAEA because most of the work, mainly with catechicats, the gold nanoparticle, was inside the therapy from IAEA with the Missouri University, with Mariano Grazelli for Quilmes University, and the professor, the nanohydrogel that I didn't present here, but another very promising, is a water nanoparticle that we are developing, is done with the collaboration with Professor Sławomir Kadłubowski from Poland, and many other countries, like Pakistan and Thailand and India, is collaborated with Portugal, Italy, and many other countries. So it's a those CRP programs are very, very useful for that. Okay, thank you guys. Thank you for the patience. It's a very long talk. Questions, if I can help you, feel free.
Wow. Lot of things. Very good. Thank you for your talking, Professor.
Yeah, that becomes difficult to, because so many things that becomes difficult to focus on.
Yes, sure.
Yeah.
I have one question before. The nanoparticle you bring, is that one that...
Pardon me?
The nanoparticle that you bring today?
Yeah,
is that one that...
Yeah, it's not modified to be cationic. It's out the modification to do...
Okay.
I don't want to talk about this modification because this is under patenting.
Yep.
So it's very promising, so we are rushing to apply for a patent for that.
Okay.
So, but there are many ways to modify to make it cationic.
I see. Okay, thank you. Questions? We have time for questions. Okay.
Okay.
I just one thing. I thought on the LinkedIn you use this gel in a horse in Santa Catarina accident or something like that.
Yes, yes. We did a kind of very large hydrogel dressings with silver nanoparticle to treat animals from the flood in Rio Grande do Sul last year, but it didn't work so well. Actually, because of the skin of the horse, the pH of for every animal, you have to develop a dressing that is fit for the. And this was done for humans, so it was not that good.
I see.
But
it was a good test.
And the dogs, the dogs, no, the horse, they were in very bad situation. So most of them they pass away.
I see.
Okay.
Okay.
Just one point. Those gold nanoparticles, they are studying dogs from the owners. The dogs had a lot of cancers, prostate cancer. Prostate cancer in dogs, they mimic the human prostate cancer one by one. So they are a gold standard. So it's very common to have breast cancer, breast and prostate cancer in dogs. In this case, we did a lot of studies on dogs applying the gold 198 for osteosarcoma and then many other kinds of cancers. And the result was, it was very interesting, very good. It was very promising. But, you know, you cannot go to clinical trials in humans because you have so many treatments for prostate cancer. And now we have the PMSA with lutation. That is it's very difficult. We apply a lot of protocols to make clinical trials in humans, but at the end of the day, the team the thing, the hostile thing, say, oh, no. No. So we're still trying.
Yeah, of course, we will try. Okay. Thank you very much. Yes, okay, yeah, perfect.
I'm not so familiar with radiation processing, but I wonder if there are lessons to be learned in radiation biology, radiotherapy from radiation processing, and vice versa. For example, in the preparation of your materials with things like oxygen and so on that are going to mitigate those early processes that create free radicals. I mean, it's a question that applies to this talk, but also the previous talk. Are there lessons to be learned for us in radiotherapy, radiobiology, in terms of the chemistry that you're now achieving?
Well, very complex questions. Thank you.
Yeah.
Very broad, complex questions. Well, most of the time, oxygen is a problem because you have with organic materials and mostly polymers, you have chain reactions, chain degradations, fission reactions. So you have to avoid oxygen as much as possible when you work with organic, mostly working with organic molecules. So all the chemistry that we will do with polymers, make long chain molecules, like even proteins, we try to avoid oxygen as much as possible. And usually, you don't need to be very careful with this process because under irradiation, the oxygen will react very, very fast with the organic compounds, and that level, small level of oxidation in some molecules will not damage the stability of our system. But regarding most of these kind of nanoparticles, I was talking with some fellow students in the coffee break, and you have to avoid the complex situation. You have to avoid complex chemistry. If you want to have a product that is, let's say, will be in the market, will go to FDA or Anvisa or so on, you need to have a very reproducible result. Reproducibility. Reproducibility means you have to work on, let's say, room temperature as much as possible. You have to work on simple chemistry as much as possible, and avoid main steps, because you cannot do reproducible things for biological, for medical application with one layer, 2 layers, 3 layers, and conjugate one thing, conjugate another thing, and so on. This, the only successful complicated chemistry that I have seen is, let's say, radiopharmacy. In radiopharmacy, you have chelating agents, you have proteins, you have, but this was a lot of effort during many decades to have something, and there are no other solution. And so that's maybe, I don't know if I answered, but.
Yes, thank you, Professor, again.